Hi, today I'm going to talk to you about central venous catheters. A central venous catheter is a special kind of IV. An IV is a small tube, like a straw, placed in a vein to give someone fluids or medicine. A central venous catheter, or central line, can stay in place for weeks and even months. A central line will allow your child to receive IV fluids, nutrition, and medicines like antibiotics or chemotherapy that can hurt smaller veins. A central line can also be used to collect blood for tests. Today I will talk to you about two types of central lines. For details, please check your central line booklet. The two types of central lines we will discuss are tunneled lines and PICC lines. This is a tunneled central venous catheter. This kind of central line enters the skin and tunnels under the skin until it enters a large vein. These are usually placed in the chest. You might hear the nurses call these central lines a Broviac. This is a peripherally inserted central catheter or PICC line. A PICC line will be placed in your child's arm. It will be placed into a smaller vein and then guided into a larger vein near the heart. There may be stitches or another device to hold the PICC in place. This video will teach you how to care for your child's central line at home, how to change a central line dressing, how to flush and give medicine through the central line, how to change a needleless connector, infection prevention and emergency care. We want you to feel comfortable taking care of your child's central line. Take the time while you and your child are here in the hospital to practice the skills we discuss. Your central line booklet is for you to take home so you can refer to it whenever you need to. Once you arrive home, talk with your home health nurse to find out what you can expect from your home care company. The central line care at home may be a little bit different than what your child received in the hospital. This is okay. Your home care company or pharmacy will give you all the supplies you need, though they may look slightly different. When you leave the hospital, you'll receive a central line go bag. Make sure your child has this with her at all times. In the go bag, you will find a dressing change kit, an emergency clamp, 2 sterile gauze pads, and antibiotic ointment. The items in this kit will help you if there is an emergency with the central line. When you do central line care, make sure the area where you work is clean. Do not do central line care in the bathroom because there are a lot of germs in the bathroom. A kitchen counter or table is a good place to put the supplies you will be using. Before you begin, clean the area where you will be working. Use an all-purpose cleaner for hard surfaces. Place a clean towel on the surface after you have cleaned it. Gather all the supplies you need and place them on the clean towel. Make sure the supplies are in a location that is easy to reach while you are doing care. Another thing you need to do is make sure the dressing is clean, dry, and sealed to the skin. When the dressing is sealed to the skin, it helps keep germs out. If your child has a transparent dressing, it needs to be changed every 7 days. Gauze dressings are changed every 48 hours. If your child has another kind of dressing, your doctor will tell you how often to change it. It is important to change the dressing on time. You also need to change the dressing if it gets loose, wet, or dirty to prevent germs from getting under the dressing and causing infection. Your home care company may do the dressing changes depending on how long your child will have the central line. However, you need to know how to change the dressing in case of an emergency. Before you start, gather the supplies: dressing change kit, procedure gloves, sterile gloves if not in the dressing kit, wash or sanitize your hands, open the dressing change kit, put on the mask, Put on procedure gloves. Remove the old dressing. Check the site for signs of infection or irritation. Take off your gloves and wash or sanitize your hands again. Put on the sterile gloves. Do not touch anything with your hands except the items in the kit until the dressing change is finished. If the skin or site where the central line enters your child's skin is visibly dirty, clean with alcohol swabs first. If the skin looks clean, you just need to clean with chlorhexidine. Clean with alcohol if visibly dirty. Take one alcohol swab at a time. Place the swab where the catheter enters the skin and move it outward on the skin in a circle. As you move out in a circle, twist the swab at the same time. Continue moving out in a circle until you have cleaned the whole area the dressing will cover. Do this with each of the 3 alcohol swabs, one by one. Clean with chlorhexidine. Take the CHG and squeeze the wings. This will break the liquid container and wet the sponge. Press the sponge lightly on the insertion site until you see the liquid on the skin. Clean the skin around the site with the CHG sponge for 30 seconds. Scrub in many different directions. When the 30 seconds are done, clean the catheter from the insertion site to the end of the catheter with the CHG sponge. Allow the area to dry all the way. This may take 1 to 2 minutes. This will keep the skin from getting irritated and allow the dressing to stick better. Do not wipe away the CHG, blow on, or fan the site. Apply skin protectant if available. Put the protectant on the skin in a picture frame shape where the dressing will be. Leave a 1-inch space around the insertion site where you do not apply protectant. Let the protectant dry all the way. This may take 1 to 2 minutes. This will keep the skin from getting irritated and allow the dressing to stick better. Put the new sterile dressing on the skin. Make sure you place the see-through part of the dressing over the place where the catheter enters the skin. Overlap the edges of the dressing under the catheter. Use 1 tape strip under the catheter and lay it flat against the dressing. Use the other tape strip over the catheter and lay it down onto the dressing. When you finish the dressing change, label the dressing with date and time. This will help you keep track of when you need to change the dressing. The needleless connector is the cap at the end of the central line where you attach syringes and tubing. At home, you will change the needleless connector every 7 days. In the hospital, we change the needleless connector more frequently, but you do not need to do this. Before you start, gather the supplies you need: procedure gloves, alcohol wipes or disinfectant caps, new needleless connector, normal saline flush, heparin flush. Wash or sanitize your hands. Put on clean procedure gloves. Clamp the catheter. Attach a normal saline flush syringe to the new needleless connector. Push a small amount of the normal saline into the needleless connector until you see a few drips come out of the end. Leave the syringe attached to the needleless connector and place it on a clean or sterile surface. Make sure the catheter is clamped. Remove the old needleless connector. Scrub the end of the catheter with an alcohol pad quickly in a back and forth motion for 15 seconds. Let the alcohol dry for 15 seconds. Do not touch, fan, or blow on the end of the catheter. Do not let the end of the catheter touch anything. Attach the new needleless connector to the catheter. Unclamp the catheter. Gently push the normal saline into the catheter. Make sure there are no air bubbles or blood left in the catheter. Clamp the catheter. If your child has a heparin lock, remove the cap on a heparin syringe and attach it to the needleless connector. Unclamp the catheter. Gently push the heparin into the catheter. Clamp the catheter and remove the syringe. Place a new disinfectant cap on the end of the needleless connector if you have them. Heparin is a medicine that thins the blood. A small amount of heparin in the catheter will keep it free from blood clots. This is called a heparin lock. It is important to keep the central line free from clots so it will work properly. Normal saline is used to flush the catheter before and after medicine is given through the central line. This will ensure the catheter does not have medicine left in it before and after each use. Flush the catheter with heparin every 12 hours when you are not using the central line. If your child is receiving medicines, you will be flushing the catheter before and after each medicine. Before you start, gather the supplies. Alcohol pad or a disinfectant cap, heparin flush syringe, procedure gloves if you have them, wash or sanitize your hands, put on procedure gloves if you have them. If your child's central line has a disinfectant cap, remove it and throw it away. You do not need to scrub with alcohol. If your child does not have a disinfectant cap, use an alcohol pad to scrub the end of the needleless connector very quickly in a back and forth motion for 15 seconds. Let the alcohol dry for 15 seconds. Remove the cap on the heparin syringe. Make sure there are no air bubbles in the syringe. Attach the heparin syringe to the needleless connector. Unclamp the catheter. Gently push the heparin into the central line. Clamp the catheter. Remove the syringe. Place a new disinfectant cap on the needleless connector if you have them. Your child's doctor may order medicines to be given through the central line. The medicine pump you will have at home will be different than the ones at the hospital. Your home care company will teach you how to use the pump. The medicine you give at home may have a different concentration than at the hospital, so the medicine may run faster or slower. Make sure you follow the instructions from your home care nurse. Before you start, gather the supplies. Normal saline syringe, heparin syringe, medicine syringe and tubing, alcohol pad or disinfectant cap, wash or sanitize your hands. If you have procedure gloves, put them on. Remove the disinfectant cap and throw it away, or scrub the needleless connector with alcohol for 15 seconds and let dry for 15 seconds. Remove the cap from the normal saline syringe and attach it to the needleless connector. Unclamp the catheter. Gently pull back on the syringe. You should get a small amount of blood into the syringe. If you can't get blood return, contact your child's doctor. Gently push 10 milliliters of normal saline into the central line. Clamp the catheter again. Remove the normal saline syringe. Remove any caps that may be on the medicine syringe or tubing and attach the medicine syringe or medicine tubing to the needleless connector. Unclamp the catheter. Give the medicine as directed by your pharmacist or home care nurse. Once the medicine is done, clamp the catheter and remove the medicine syringe or medicine tubing. Remove the cap on a normal saline syringe and attach it to the needleless connector. Unclamp the catheter. Gently push 10 milliliters of normal saline into the central line. Clamp the catheter and remove the syringe. Remove the cap on a heparin syringe and attach it to the needleless connector. Unclamp the catheter. Gently push 3 to 5 milliliters of heparin into the central line. Clamp the catheter and remove the syringe. Place a new disinfectant cap on the needleless connector if you have them. On rare occasions, the catheter breaks apart or gets a small hole in it. If this happens, quickly kink the catheter with your fingers anywhere between the hole and the site where the catheter enters your child's skin. Find the emergency clamp in your go bag. Clamp the catheter between the hole and the site where the catheter enters the skin. If the catheter breaks apart, wrap sterile gauze from the go bag around the broken or damaged end of the catheter. This keeps germs from getting inside the catheter. Call your doctor and tell him what happened. Call your home care company and tell the nurse what happened. If the catheter accidentally comes out, press firmly on the place where the catheter came out of your child's skin. Use a sterile gauze pad, a clean towel, and your hand to hold pressure on this area for 5 minutes. If the bleeding does not stop after 5 minutes, go to the emergency department or call 911. Continue putting pressure on the site where the catheter came out. If the bleeding does stop after 5 minutes, open the dressing change kit from your go bag. Clean the site with the CHG pad. Put a small amount of antibiotic ointment over the site. Put a sterile dressing over the site and leave it in place until your child can see a doctor. Call your child's doctor. Thank you for taking the time to watch this video. We encourage you to take an active role in caring for your child's central line. The more you practice these skills here at the hospital, the more confident you will feel in caring for the central line at home.